Discharge Use Manager of Ward 4, which is a shared model of care between rehabilitation and acute medicine in the winter. In our ward we have always had a policy of open visiting. Families have come in and visited all the time. On balance, we find that open visiting to be, and with families staying, really positive, but we do have strict guidelines and expectations which we set out at the beginning. With the strict guidelines, it is really important to set out the expectations. If you don't, then that's where issues occur later on. We use security if rules are breached. We don't normally talk about that, but we do for families that are causing problems. We set out the expectations we set out are these. We only have one carer stay per patient. That's at night, and that's really important. Too many are in the way of nurses. They must respect the other patients and staff, that keep the noise down and be quite respectful, because they are in two-bedders and the other roommate can be a little bit upset. We don't provide food or fluid, but we do provide a fridge where they're welcome to bring their food in, have it labelled and dated and kept in that fridge. One of the reasons that we're very careful with the labelling and dating is because we have to meet our guidelines, standards for the certification, but also we're looking at infection control as well. There are lots of pluses. We work in partnership with the family and we develop a good rapport with them. So we keep that communication going through all the time, and we actively work out looking at where there are any barriers to discharge and things like that. So we can actually reduce our length of stay by having family involvement at the beginning, particularly if someone is perhaps not responding to treatment and may land up possibly requiring care or something like that. The families see that early on in the picture. The nurses actively promote and ask family to stay. They are actually disappointed if family can't stay in certain circumstances, because they assist them in many ways, and the most obvious one is translation. So we have many patients with unusual languages, and it's hard to get interpreters, and it makes life difficult for nurses trying to give their care at night, and also for the allied health and doctors to work with the patients. The family participate in cares, and the nurses, it gives them an opportunity to teach them cares, particularly if they're going home and these carers are going to be the main caregivers at home. So we got that opportunity to teach them. It's not compulsory, they don't have to participate in the care, and a lot of them choose not to, but there are many that do. The family are very aware of the patient's response or non-response to the treatment, as I mentioned before, so the team are updating them constantly, and it helps them come to terms with where their family member is. We discover the barriers to discharge earlier, as I mentioned before, and that helps reduce our length of stay. And they're advocate for the patient, so the patient, we don't have to go and try and contact them. They're right on the spot generally. Even if they're not the main enduring power of attorney, they're in close contact with their family members and they can come back to us. For our delirious, confused and aggressive patients, they're absolutely marvellous, and in fact we ask them to come in, particularly in the evening and night, where we have delirious patients who can be quite aggressive and difficult to handle. They can be high falls risk or very anxious, and family members here reduce all of that, makes it much easier and safer for the patient. Also helps with wandering patients as well. Added to that is also when they're confused and delirious or aggressive, we often can't get medication in, even their normal medications, and family members are often able to get it in for us. The family are available for input into any of our care plans, consents for any treatment, etc. So they're very handy and make life a lot easier for us. As a result, we have less complaints because the family are actively involved in all aspects of the patient's care and decision making. So those are the pluses. Issues, it can be a bit noisy at night, particularly if you have the family member going out to have a smoke, and they do. Coming back and ringing the bell is an issue, and that's why we also limit it to one person. The roommate not happy with someone else being in there, so again it's about that respecting other people from the carer. Too many family try to stay or meal together. We resolve that by using the lounge and also our meeting room, so they can go in there and join in together, take their family member in there. The other thing is that we do sometimes have problems with some families taking over the lounge. They have children not supervised in the lounge, and we've had to talk to them about not leaving children unsupervised. We also lock the lounge at night if we have families that are causing issues. Sometimes they can be disrespectful to the nurses at night, or sleep on patient's bed. We've had that on one occasion with a very young teenager. So we got a chair for the person. So it's just understanding those expectations. The carer hygiene, personal hygiene, can be an issue, so we do encourage family to swap over and allow that person to go home and have a shower, etc., and come back. The expectation of the food and fluids, so that has been one. They've felt that they should be entitled to have it, and we've had to explain that Counties does not actually provide food to patients. We have given them tea and coffee, but we do encourage them to bring their own in. The other thing is about, we use our bedside bench where people stay, so that's the main place, and sometimes with the ward being full, it's difficult to manoeuvre patients around so that the carer can sleep on there. If we bring in a lazy boy beside the other bed, it actually adds to the clutter in the space and makes it difficult for nurses to get around the bedside. So those are some of the issues. But overall, we have had great success. We've had very few issues. We have had to call security a couple of times, but those families were difficult anyway. I usually sort out any of the issues. The nurses are really good at sorting it out. And the benefits with our patient care, particularly those confused, delirious patients, is fantastic, and we just love them staying.